Right, hi. Welcome to this brief overview of Tomo VR, which is the new technology that's been released in autumn 2017. So if you're watching this video, perhaps you've had an email to alert you to that, and you can from the autumn 2017 you can actually go on our website and request an evaluation copy of this exciting technology. So what's it do? It simulates the process of taking a CT scan exam on a patient, and this is very useful for education of technologists, radiographers, and there aren't many other options out there to get some familiarity with the concepts of CT scanning without taking up precious time in clinical practice. So we would see this as a perfect demonstration tool to use in class to outline the steps and the procedures that you have to go through to position a patient for a CT scan, and talk about the terminology and to give an idea of the functions of various parameters that are required, and we actually also provide dosimetry values for the exams that are done within the simulator, so that can be used to compare radiation risk for various patient groups. So I'm going to go right ahead here and actually show you how it works. Okay, so you've got 2/3 of the screen taken up with the actual console, and 1/3 of the screen taken up with the actual exam room. Okay, these are independent windows, so you can actually change the sizes. So if you want to just use a little bit less, you can. And various controls. So let's just go through it straight away. So go to the study tab, go to the modality work list, and we've got our patient here who was actually having a CT thorax, which we've already done. So here's the resultant scans. This was the scan plan and the 2 localizers. So what I'm going to do is I'm going to take this patient off the table. Okay, put his hands down, poor chap, and take him off the table. And now what we're going to do is dismiss him, go back to our modality work list again. Now we've got a whole range of patients that we can bring in. So let's try something I haven't done before. So we'll try a CT scan of the pelvis. Okay, so we have the clinical history here, and we have the indication. So we know the patient's age, and we know what sex they are, and how they're coming to transport. So we're going to make that selection. So the system updates, and if we pick the localizer to do first, then it gives us a bit of a hint. So the localizer should cover the proximal third of femur to the iliac crests, and we've got the localizer direction and the localizer extent already populated in here. Right, so let's go get our patient. So we go into our room, pick our patient. So there they are. Now it tells me that the patient should go feet first into the scanner for a pelvis CT. So I've put them on the table, but they've gone on head first. So what I have to do is put them on the table from this side, so they go on feet first. Now, you know, it depends on your hospital protocol. This one is suggesting this is the right way to do this. So I'm going to just follow that at the moment. So I'm going to position our patient up. Obviously I would talk to them, give them some information. I'll put my laser lights on. Table needs to be raised to, these are where I get my controls that would normally be on the side of the gantry, but they're all up here, so I can get my localizer height correct, get my start position sorted, so I think he needs to move a little bit this way. I'm happy with that. Good, so I'm going to zero that position, I'm going to turn my laser lights off. I think the isocenter was right. I'm going to talk to the patient, tell him what's going to happen, and I'm going to raise his arms. Okay, so he knows that he's going to be scanned into the machine here. So here it tells me the table's going to move in, and it's going to move in 40 centimeters, which is about right. So I'm going to acquire that. So in he moves, as you can see, and we're getting our localizer up here. And because we've got lateral and AP localizers being generated by this scanner, and that's by default, we get 2. Now that's quite cool. Some scanners don't do that, but for educational purposes I think it's pretty good. So we just want the pelvis, and we want the full extent of the pelvis. So I'm going to move my start line. So my green line is a start line, and my red line is a stop line. I only just got the crests on, look, so I'm going to have to put the stop line right at the top of the localizer. And I have my display field of view, which I can actually, I've not quite got him straight, so I'm going to have to use quite a wide display field of view just to make sure I get the crest on here. So I'm happy with that plan. So I'll talk to him on the intercom, tell him that we're just about to do the full scan, and then I'm going to move into picking the plan here. So go to the scan menu. This is the parameters that are going to be given for this pelvis, and this is my planned area of scan, so I'm going to load that plan. I'm going to move him to the start position, and then I'm going to acquire that plan. So he moves through quite quickly, and we get our images up here. I'm going to go to Bony Windows, and it will gradually step through the scans that we have already acquired here. I can actually speed up and go through a bit quicker, look at anything in particular that I'm interested in. Calcification in the aorta. I've got all the area that I need, so I'm happy with that. So I'm going to tell him that we're going to be getting him off the table. He'll come in here, going to put his hands down, bring the table out, and lower the table down to standard height, and he can come off the table. We can discharge him. So there you go. I'm just going to leave it at that. Lots of questions you may have, in which case please book an appointment to talk us through the fantastic potential this will have for teaching your students in the future. It's one of 4 of our simulators that we have. We also have a projection radiography simulator. We have a physics simulator that simulates the X-ray beams of mammography, fluoroscopy, and really goes to detail about all of the quality assurance criteria, and we have a lecture VR, which is a radiographic anatomy simulation as well. So thanks very much for listening. Get in touch if you found this interesting and you would like to learn some more and get an evaluation copy.